In this video, I'll show you how to release tight QL muscles and how to alleviate pain in your neck and thoracic spine. Most importantly, I'll explain the connection between your rib cage and lateral pelvic tilt, or left AIC pattern. So I've got you covered. Relax for a moment and let's go.
Firstly, please imagine that at some point in history we were like an apes who were climbing up, climbing down, and doesn't really matter whether you are believing in the theory of evolution or you don't. Our pre-ancestors were using upper appendages, upper limbs, way more often than we do right now.
Our modern westernized lifestyle has significantly affected our natural posture. In old times, we relied more on arm support, whether it was climbing trees or working in the garden. As we evolved into the Western world, such activities have become less common, and this has predictably affected the dynamics of our rib cage and scapula. So, how has this change manifested? It all has something to do with our arm usage. There is a direct correlation. The more we use our upper limbs, the more natural the shape of our rib cage is. Therefore, when we use our arms correctly, it promotes airflow to the posterior rib cage. However, when we remain extended consistently, the airflow is predictably directed to the anterior part of the rib cage. So expanded posterior rib cage is good, and deflated posterior rib cage is bad byproduct of our modern world. Now consider top-tier MMA fighters. Many grapplers have a noticeably expanded posterior rib cage. Take Khabib Nurmagomedov as an example. From a young age, he wrestled with bears and competed against other athletes. Due to his consistent arm usage, it has predictably shaped his rib cage. Just take a look. It resembles the natural rib cage structure our ancestors had, a beautifully natural rib cage. Now what about QL muscles? Now if a person has a normal /factory set position of the pelvis and rib cage, the quadratus lumborum muscles have an optimal position. However, in typical cases, the positions of these bones relative to each other are disrupted. The pelvis and the lower ribs are too close to each other, which means the muscle will be in constant concentric tension because the attachment points of the muscles are getting close to each other. So to open up QL, you have to expand your posterior rib cage.
And this is desirable effect. By opening up your posterior rib cage, you can release your QL muscles, you can release your erector spine muscles, and at times you can release the tension in your neck, SCMs, and so on and so forth. So, with that being said, I am inviting you to proceed to do the exercise that I will show you right now that will mimic, just for a minute, to be an ape. Once again, let's imagine that we are apes, and we have to use our arms for the weight distribution. So firstly, bend both elbows, tuck your pelvis into the posterior pelvic tilt very gently. Don't do it like this, it's not necessary, just gently. Now, the first step is to distribute and shift the body mass forward like this. This will create an additional support onto the arms, so you will treat your arms like it would be the second pair of your legs. Because of that position, you have to feel the contractions here all the way down in your abdominal region. You have to feel the contraction of your transversal abdominal muscle. Hold that position, and now bend both elbows once again. Move your sternum up towards the ceiling like this. And this is position in which you have to breathe correctly. So breathing through your nose, breathe out through your mouth. 1, 2, 3. Breathe in into the rib cage, into your back. Breathe out. The first aspect, remember that you need to pull your shoulders forward in order for your scapular to be fully protracted forward. So If you don't feel how your posterior part of ribcage is getting expanded, I can suggest for you to find a partner who could place his or her arm onto your ribcage. Look here. Once again, move your shoulders forward, move your sternum towards the ceiling, and now each time I will do breathe in, I will move her arm towards the ceiling as well, and I will expand my ribcage here. So that should help you to feel your posterior part expansion much better. Don't do it by yourself. The very important mistake that you should avoid at all costs: when you are moving your body forward onto your arms, you should not allow yourself to extend like this your lower back. If you would extend yourself like so, you would lose the position of your diaphragm and of your ribs. You need to tuck your ribs inside yourself like this, and because of that you have to keep yourself always a bit rounded. It's completely forbidden to do it like so. Don't do it like so, but do it like so, and hold that posterior pelvis tilt all the time. That's it.
If you're seeking more exercises and a personalized approach, you have a few options. Use my personalized online PRI coaching. The link will be in the description. Visit us in Poland. We combine the PRI approach with optometry and podiatry to achieve truly holistic approach. And of course, pain relief. And lastly, look out for my upcoming online pelvis restoration course. Stay tuned for more updates. See you around.